Hi there, my name is Amanda Jules, and today I'm going to be discussing quality of care within nursing homes. Nursing homes are facilities for individuals who require continual nursing care and are unable to fulfill the activities of daily living. For example, cooking, cleaning, grocery shopping, and just maneuvering around your home. In these residential facilities, nurses are available 24 hours a day, 7 days a week. Generally, patients are admitted to nursing homes when family members are no longer able to provide this intensity of care. Most commonly, physicians make recommendations in regards to a loved one's admittance to a nursing aid facility. Although nursing assistance is provided around the clock, most facilities are overpopulated and understaffed. Therefore, the quality of life for patients greatly depreciates. In recent decades, there have been several changes to the healthcare delivery system and several advances in the science of medicine, which has ultimately led to the increase of life expectancy for Canadian residents. With a combination of these factors and an accent on the quality of care, it has substantially increased the care needs for nursing home residents. In most countries, the government is involved in the supervision and regulation over the nursing home industry. The oversight of nursing home ensures the implementation of policies that will help protect staff and patients. In Canada, a large percentage of nursing home facilities are aided by government funding. However, funding does not cover all operating expenses. There are three types of long-term care facilities: public, subsidized, and private. Public and subsidized long-term care facilities are very similar. They only differ in ownership. The Regional Health Authority owns public long-term care facilities, whereas subsidized are facilities that are privately owned and receive funding. Since the provincial government regulates the public and subsidized care facilities, they are the same in all aspects, including funding, admission criteria, and costs to patients. However, private facilities are entirely self-governing, therefore they do not operate under the government. Without the government's ownership, they are entirely independent but must maintain provincial standards, and the Minister of Health must grant the facility with a license to practice. Nursing homes are firmly regulated long-term care facilities that operate in an institutional manner rather than in a fashion personal homes function in. Due to the institutional atmosphere of nursing homes, they lack the comfortable, welcoming, accommodating, and informal ambiance of personal homes. With the absence of these homey atmospheric characteristics, it is more challenging for residents to accept both the life stage they are now in and their new home. Therefore, the quality of life for these residents is again negatively impacted. Nursing home life is very sterile, regimented, absent of privacy and meaningful association, and neglects the human spirit. However, it should both preserve and promote the quality of life. Transitioning from living in a personal home to a nursing home is a major life event. If the patient and family members are not prepared for this possibility, it could also become a major life trauma. It is critical for nursing home staff to be sensitive and understand the various losses the residents faces as they enter the facility. Staff must also be prepared for possible reactions that may occur as a result of the life-altering event. Nursing homes cannot only be uncomfortable to residents but to visitors as well. The sound, sights, environment within the nursing home often intimidates the individuals who come to nursing homes to visit relatives and friends. As a direct consequence of the intimidation, it is common for individuals to stop visiting nursing home residents. Whether a person is moving into a public, subsidized, or private long-term care facility, their life will be substantially altered. Transitioning from living in a home to a nursing home is very different. Patients lose the freedom, privacy, and responsibilities they once had, as they now live in essentially a hospital. Most nursing home residents perceive the facility as a place they go to die, when they become too weak or frail to be cared for at home. This is untrue, which is why the quality of life is so critical. It is important for patients to be happy, for them to enjoy the rest of their lives, and to accept living in a long-term care facility. Long-term care facilities provide nursing services to patients of a wide spectrum of physical and mental capabilities. Most facilities accommodate services to patients of various capabilities rather than undertaking patients that require the same extent of care. Due to this, patients who are mobile and socially active could struggle finding peers with their same capabilities and desires. Therefore, patients with fewer capabilities require additional care and limit the quantity of attention that can be provided to patients that function at a moderate to high capacity. Habitually, there have been endless issues regarding the manner in which nursing home employees treat their residents. Normally, residents are treated with the lack of courtesy, respect, or affection. In efforts to sustain the rights of nursing home patients, the government has implemented laws to increase the quality of life. To comply with these laws, facilities must conduct an assessment of residents' needs within 2 weeks of admission, give residents a right to choose activities, schedule and health care is coherent with their needs and interests, and provide the necessary care and services that enables residents to maintain their highest level of physical, mental, and social well-being. With the intent to fulfill the purpose of this literature review, previous research has been analyzed to assess the nursing home resident's perspective on the quality of life he or she receives in the long-term care facilities. Previous literature has provided various reliable findings in regards to specific programs that should be implemented in nursing homes to better the physiological health of residents and to ultimately increase their quality of life. One of the contributing factors to insufficient research of quality of life in nursing homes is because healthcare researchers view quality of life as solely health quality status. In order for reliable findings, healthcare researchers must encompass both health-related care and elements of living into the quality of life status of nursing home residents. In Keynes et al. Study on the quality of life for nursing home residents, they first identified several different methods to gather data in regards to the quality of life in nursing home residents. Researchers for this study considered the gold standard for collecting this type of information would be through a self-reported system for residents and surveying both staff and family members. Interesting, when comparing the data from the staff and family members, the results were typically correlated with one another, but far identical. Research from this study identified 11 domains of adequate quality of life, including comfort, functional competence, autonomy, dignity, privacy, individuality, meaningful activity, relationships, enjoyment, security, and spiritual well-being. Although it has been established that nursing home residents are unhappy with their quality of life, researchers have been working to find potential services that can increase their quality of life. As previous literature has found, exercise acts as a preventative and therapeutic intervention as it aids in keeping muscles and bones strong and ultimately helps protect against falls. In Barreto et al.'s study, they assessed how much physical activity nursing home residents were receiving in their daily life and the effects of exercise on quality of life. Barreto hypothesized that the presence of a personal exercise instructor would be associated with increased participation, frequency, duration, and levels of physical activity in nursing home residents. Therefore, there would be an increased physical activity levels of nursing home residents. There are several limiting scopes in this literature review that test the validity of this research. Keynes et al.'s study included patients of varying cognitive function, ranging from fully functioning patients to patients with severe mental disease, for example, dementia, Alzheimer's, schizophrenia. Due to the inclusion of patients who have low cognitive levels, it is hard to determine the accuracy of their self-reported information. Although Barreto et al.'s study was much stronger because it did not heavily rely on cognitive levels of participants and a small sample size, therefore no major conclusions can be accurately drawn from this research. To conclude this literature review, it has been found that the general consensus for quality of life amongst nursing home residents is low. Patients struggle significantly with the transition from living in a personal home to a long-term care facility, and the unwelcoming, hospital-like atmosphere does not make the transition any easier. To ensure a better quality of life for their nursing home residents population, changes must be made to sustain their pre-nursing home life, mental and physical well-being.